Next is herpes simplex virus. You remember this is dewdrops on a rose petal or vesicles on an erythematous base that usually occur in a group. We also don't have a cure for this, but and so it can be recurrent. This is a patient with herpes labialis, and in between, or it tends to recur at times when the host is immunocompromised, and that might be even something as minor as getting a lot of sun exposure. Remember, we use ultraviolet therapy for treatment in things like psoriasis or atopic dermatitis, so ultraviolet light can be just enough to locally cause some suppression, immune suppression, that's enough to allow the herpes virus to recur. Also, febrile illness, so hence the term fever blisters, same thing here. Here's an example of clustered vesicles here on this patient's genitals. And if you do a Zank prep, which means opening the vesicle and doing a scrape at the base of the vesicle, so remember that's in contrast to looking for the dermatophyte and vesicular dermatophytosis. Here now to look for herpes viral findings, you scrape the base of the vesicle, and what you see under the microscope is a multinucleated giant cell, and that's what we're looking at right in the center here, as a large multinucleated giant cell, which is indicative and diagnostic for herpes simplex viral infection, or herpes viral infection. So here again, a cluster of vesicles, an erythematous base on this patient's lip, so herpes labialis. Here a cluster on the patient's fingers. And the same findings. This is getting a little bit cloudy, so maybe an older vesicle that now is looking more like a pustule, but you still have that nice erythematous base there. Something you might consider in the differential here is that gonococcemia, because remember that was a vesicle with the purpura in the background, but this is kind of a lot, so you don't tend to see those gonococcemia pustules in clusters like this. When you see those clusters, you definitely need to think about HSV. Here's a patient with pretty widespread involvement, and here, even though the vesicles are no longer intact, you can still see these round erosions with some confluence here into these larger erosions, but you can still kind of see the outline of where those vesicles used to be. This patient may have a sunburn or some other damage to the skin that's resulting in a more severe, more widespread, could be even eczema herpeticum. Remember, a complication of atopic dermatitis that we talked about. Here again, this is an immunocompromised individual who really has developed ulcerations as a result of herpes simplex viral infection. Unusual in an immunocompetent individual, but here again, in some places you can still see those punched out ulcerations from where the vesicle used to be, and you can see the scalloped border through here, indicating where those vesicles have now become confluent there. Another immunocompromised patient with a very widespread HSV infection, and even here the morphology is still relatively maintained with vesicles here in a large area and then sort of a hemorrhagic crust right on top there. So the varicela zoster virus is also in the herpes virus family. So a Zank prep from a patient with varicela zoster virus is also going to be positive. So just for clarification, the Zank is positive in all the herpes viruses, and it can't distinguish one from another. Varicela zoster virus can cause two different disorders. It can cause varicella or chicken pox, where vesicles occur in crops and resolve in crops. So what you see are vesicles at various stages of maturity. And that's in contrast to, say, smallpox, because I know you remember that smallpox are all in the same stage of development at the same time. Herpes zoster is also caused by the varicella zoster virus, also known as shingles, and that looks like vesicles in a dermatomal distribution. So let's look at some examples of those. Here are chicken pox. Vesicles, again, a nice vesicle full of fluid there is going to be a good place to do your Zank prep and look right from the base for those multinucleated giant cells. But you can see Here are some that appear smaller and that are sort of younger, and then another with kind of a crust on top that may be older, so various stages of evolution here. And then here's a patient with shingles related to varicela zoster virus. So you can see that nice dermatomal distribution. For the most part, it stays on one side, although it's not out of the question to have a couple of vesicles here and there that cross the midline. It's a good idea to have it in your mind that it should not, but the reality is occasionally you can get a few vesicles that are even across the line. You can see this is pretty significant. These sort of darker areas look like the patient may have some necrosis there and may get some ulceration. Another patient with shingles. This patient is showing something called Hutchinson's sign, which you probably remember hearing about before. That's when patients have involvement of the nasal tip with varicella. It indicates involvement of the nasociliary branch from that ophthalmic nerve, or V1. And so this is a circumstance where you need to get ophthalmology involved pretty quickly. So again, when you see that nasal tip, Hutchinson's sign, call for ophthalmology consultation for sure. And here again, another example, kind of a lumbar dermatomal involvement here with vesicles in that erythematous base. Children are not immune from getting varicella. So here's a patient with a V1 distribution of shingles, but notice his nasal tip is not involved, although he looks like he may have some ophthalmic involvement as well. So probably a good idea to get the ophthalmologist to see this patient as well. And then even infants can have shingles. So here's an example of that. And in all those cases, again, your Zank prep's gonna show a multinucleated giant cell, just like we're looking at right in the center here.